Karthik Chandra, surgical oncologist and robotic surgeon. This is going to be a short explanatory video regarding the robotic surgical system. Now, the robotic surgical system has three key components. One is the patient cart, which is the heart of the robo, and then you have the vision cart, and the third part is the surgeon's console. The surgeon sits here and operates the robo, and that's how the surgery proceeds smoothly. This is the patient cart, which is the heart of the robo. Now it has four arms. You can see these four arms, and this, the central arm is the camera arm. So the camera, the lens system is connected to the camera arm, and there are three other arms. Now, unlike just like laparoscopic surgery, we have these robotic ports. Most of them are 8 mm ports or 5 mm ports. Here these are 8 mm ports, and these are introduced into the patient's abdomen just like we do in any laparoscopic surgery. Now, the other advantage of the main advantage of robotic surgery over laparoscopic surgery being the surgeon controls the camera and he also controls the other three arms. So the in the three arms we can place instruments which are similar to the laparoscopic instruments but with better maneuverability. So the surgeon controls the camera, he can move the camera wherever he wants to. He can also move the three arms whenever and however he wants to, which is not possible in the traditional laparoscopic surgical systems. Now I'll show you docking, which is connecting the port to the robotic arm. Okay, so the camera port has already been docked. Now I have docked the second arm. The first arm is also being docked. Okay. So once docked, see, this is the movement that is possible here. Regarding the lens system, we have both a 0-degree system and also a 30-degree up and down system, which will help us operating smoothly. This is the vision cart. So the vision cart is like the CPU. It is attached both to the patient cart and also to the surgeon's console, and this is the screen which basically helps the assistant surgeon and the rest of the support staff including the nurses to follow the surgery. It also has place for the lens system and also the electrosurgical system, and there is a significant advantage with this kind of a screen because this allows telestration. For example, if there is a trainee surgeon who is operating, the trainer can point out certain things. So you can telestrate and show where to operate, what to do and how to proceed. So this can be, you can mark and show. This is the surgeon's console. This is where the surgeon sits and operates. So this is the headrest, and these are the infrared sensors which are there on either side, and this is the 3D high definition stereoscopic vision system. You can only see a 2D picture now, but when the surgeon sits he can see a 3D picture. Okay. Now a very key component of this system is the infrared sensor. It is a very good defense mechanism so that the patient does not get injured. So the system gets activated, the patient cart and the instruments can move only if the surgeon's head is inside the headrest. Once he takes the head away from the headrest, the instruments cannot move. Now the other parts of this surgeon's console are the master controllers. These two are the master controllers. The master controllers precisely transfer the surgeon's movements to the patient cart without any tremor and without any other disturbance. ensuring that the surgery proceeds smoothly. Now you can make out the movements here. Okay. Now this is the part which will help in changing the ergonomic controls of the system. You can see the headrest moving up and down. You can change the height of the armrest so that the surgeon sits smoothly. Then the foot panel has various switches. The key switch is the camera switch. Now once the camera switch is activated, the surgeon gets control of the camera. Now you can see that when the master controllers are being moved, the camera focus is changing as per the surgeon's wish. Then the toggle switch button which is there is used for changing the control from one arm to the other. Then you have the 2 yellow and 2 blue buttons which are just similar to the monopolar and bipolar cautery systems which we use in any other open surgery. The right side yellow and blue buttons are useful for controlling the energy device on the right side, and the left side switches are useful for controlling the cautery settings on the left hand instrument. Comparison between the laparoscopic instruments and the robotic instruments. On the left hand is the laparoscopic instrument which has only 2 degrees of freedom. One is the insertion and the exit, the other is the opening and closure of the jaws. On the right hand is the robotic instrument where apart from these routine movements you have 540 degrees of rotation. You also have 7 degrees of freedom. And this movement is similar to the human wrist. That's why it is called the Endorest Moment, which is helpful in holding things, and it's of very good use while suturing. This is a comparison between the laparoscopic and the robotic instruments. It is quite obvious that the robotic instrument is much longer than the laparoscopic instrument. Now this helps us very much when we are operating deep in the pelvis. For example, while doing a radical hysterectomy in females, or while doing a prostatectomy or doing an ultra low anterior resection. It also helps when we are operating in obese patients, because the length of the instrument is longer, the reach is better. Based on my experience as a surgical oncologist, with the experience of operating on various parts of the abdomen or in the chest, while comparing open, laparoscopic and robotic surgery, the advantages of robotic surgery are manifold. The most important of it being, here in robotic surgery we control the camera and all the 3 instrument arms. Now this is the work done by 3 different people in a laparoscopic surgical. The other main advantages being tremor filtration, reduced fogging, having a very high definition 3D stereoscopic vision which you can control yourself, and also having the comfort, ergonomic comfort of sitting comfortably on a chair and operating. Especially when we are, as an oncosurgeon, when we are operating, when we are doing long surgeries, this ergonomic comfort comes into play. You also have the advantage of the Endorest instrumentation with its superior maneuverability and better handling of the intra-abdominal or intrathoracic organs. That in a nutshell is the advantage of robotic surgical system.